Hi, welcome to Professional Certifications channel. Let's break down RHIT exam preparation, one topic a day for focused and effective learning. Today's topic is Continuum of Care.
Definition: Continuum of care refers to the comprehensive, coordinated system of healthcare services provided to patients over time, across different levels of care and healthcare settings. The goal of the continuum of care is to ensure that patients receive the right care at the right time and in the right place, from preventive services through to acute care, rehabilitation, and long-term care. It emphasizes seamless transitions between different phases of care, ensuring that patients are supported throughout their healthcare journey.
Key components of the Continuum of Care. 1. Preventive and Wellness Services. The continuum of care begins with preventive and wellness services aimed at promoting health and preventing illness. This includes health education, screenings, vaccinations, routine checkups, and lifestyle counseling to help individuals maintain their health and prevent the onset of chronic diseases. 2. Primary care. Primary care providers are typically the first point of contact in the healthcare system. They manage routine health issues, provide ongoing care for chronic conditions, and coordinate referrals to specialists when necessary. Primary care is a foundational component of the continuum of care, ensuring that patients receive timely and appropriate care. 3. Acute care. Acute care includes urgent, short-term treatment for severe injuries or episodes of illness. This is typically provided in hospital settings, emergency departments, or urgent care centers. Acute care services may involve surgeries, hospital admissions, and treatments for conditions that require immediate attention, such as heart attacks, strokes, or trauma. 4. Specialty care. Patients may need to be referred to specialists for more advanced or specific medical care. Specialty care involves expert services provided by healthcare professionals focused on particular areas of medicine, such as cardiology, oncology, orthopedics, or neurology. These services may include diagnosis, treatment, and management of complex or chronic conditions. 5. Post-Acute and Rehabilitation Care. After receiving acute care, patients may need post-acute or rehabilitation services to help them recover and regain independence. This can include physical therapy, occupational therapy, speech therapy, or other forms of rehabilitation to support recovery from injury, surgery, or illness. 6. Long-term care. For individuals with chronic conditions or disabilities who need assistance with daily activities, long-term care services may be required. These services can be provided in a variety of settings, including nursing homes, assisted living facilities, or home healthcare services. 7. Palliative and Hospice Care. Palliative care focuses on improving the quality of life for patients with serious illnesses by managing symptoms and providing emotional support. Hospice care is provided for terminally ill patients, focusing on comfort and end-of-life care. Both services aim to improve the patient's quality of life by addressing physical, emotional, and spiritual needs. 8. Home and community-based services. Many patients prefer to receive care in their homes or communities. Home healthcare services, such as nursing care, physical therapy, or home health aides, allow patients to recover or manage chronic conditions in the comfort of their own homes. Community-based services, such as adult day care or meal programs, support individuals who need assistance but want to remain independent. 9. Patient education and self-management. An essential component of the continuum of care is patient education and self-management. Patients are encouraged and taught to take an active role in managing their health conditions, whether through medication adherence, lifestyle changes, or understanding warning signs that require medical attention.
Importance of continuum of care. 1. Improved patient outcomes. The continuum of care ensures that patients receive coordinated, continuous care throughout their healthcare journey. By addressing healthcare needs at each stage, the continuum improves health outcomes by promoting early detection, timely interventions, and comprehensive follow-up care. 2. Enhanced care coordination. Seamless transitions between different levels of care, such as from acute care to rehabilitation or long-term care, reduce the risk of gaps in treatment or miscommunication. Care coordination ensures that all providers involved in the patient's care are aligned, improving the efficiency and effectiveness of care delivery. 3. Reduced hospital readmissions. By ensuring patients receive appropriate follow-up care after discharge from a hospital, the continuum of care helps prevent complications and reduces the likelihood of hospital readmissions. Post-acute care, rehabilitation, and home healthcare services are essential in preventing costly and preventable readmissions. 4. Increased patient satisfaction. Patients benefit from a more integrated, patient-centered approach that considers their healthcare needs across different settings and services. With smoother transitions between care levels and personalized care plans, patients are more likely to feel supported and satisfied with their care experience. 5. Cost efficiency. The continuum of care model emphasizes preventive services, early intervention, and effective care transitions, which reduce the need for expensive emergency care or prolonged hospital stays. By keeping patients healthier and reducing unnecessary care, the model can help lower overall healthcare costs.
Challenges in implementing the continuum of care. 1. Care fragmentation. One of the major challenges is fragmentation in care delivery, where healthcare services are provided in isolation, without coordination between different providers. Patients may experience gaps in care, conflicting treatment plans, or difficulty navigating between care settings. 2. Data sharing and interoperability. Effective care coordination requires seamless sharing of patient data across healthcare providers and settings. However, many healthcare systems struggle with interoperability, which hinders the ability to share patient information in real time and across different electronic health record (EHR) systems. 3. Patient engagement. Patients may not always be fully engaged in their care or understand their role in managing their health across different care settings. Educating and empowering patients to take an active role in their healthcare decisions is critical to ensuring continuity of care. 4. Resource and workforce constraints. The continuum of care requires adequate resources and a skilled workforce to provide care across different settings. In areas with limited healthcare infrastructure or a shortage of healthcare professionals, it can be challenging to deliver comprehensive, continuous care. 5. Coordination across providers. Ensuring smooth transitions and communication between primary care providers, specialists, hospitals, and post-acute care services can be difficult, especially when multiple organizations are involved. Care coordination can break down when providers work in silos or use different communication platforms.
Best practices for implementing continuum of care. 1. Care coordination teams. Implementing care coordination teams that include primary care providers, specialists, case managers, and social workers ensures that patients receive well-coordinated care. These teams work together to develop comprehensive care plans and support patients as they transition between different care settings. 2. Health Information Technology, HIT. Use electronic health records, EHRs, and health information exchanges, HIEs, to facilitate the seamless sharing of patient information across providers and care settings. HIT improves communication, reduces duplication of tests, and ensures that all providers have access to up-to-date patient information. 3. Patient-centered care plans. Develop personalized care plans for each patient that outline their healthcare needs, treatment goals, and preferences. Care plans should be shared with all providers involved in the patient's care and updated regularly to reflect changes in health status. 4. Patient education and self-management. Educate patients about their conditions, treatments, and the importance of follow-up care. Providing patients with the tools and knowledge to manage their health independently is crucial for preventing complications and promoting long-term health. 5. Use of technology for remote monitoring. Telemedicine, remote patient monitoring, and mobile health applications can help patients manage chronic conditions, track their progress, and stay connected to their healthcare providers. These tools ensure continuous care, even when patients are not physically in a healthcare setting.
Future trends in continuum of care. 1. Telehealth expansion. Telehealth will play a growing role in the continuum of care, providing patients with remote access to healthcare services, reducing the need for in-person visits, and supporting care continuity for patients in rural or underserved areas. 2. Increased focus on social determinants of health, SDOH. Addressing social determinants of health, such as housing, transportation, and access to healthy food, will be increasingly integrated into the continuum of care. Healthcare organizations will work more closely with community-based services to provide comprehensive care that addresses both medical and social needs. 3. Value-based care integration. As value-based care models become more prominent, the continuum of care will align with efforts to improve patient outcomes, reduce costs, and enhance care coordination. Providers will be incentivized to deliver care that promotes long-term health and minimizes unnecessary hospitalizations. 4. Population health management. The continuum of care will increasingly incorporate population health management strategies, using data analytics to identify high-risk patients and target interventions that prevent disease and improve health outcomes across populations.
Conclusion: the continuum of care is essential for ensuring that patients receive comprehensive, coordinated healthcare services across their entire healthcare journey. By focusing on seamless transitions between different levels of care, the continuum of care improves patient outcomes, enhances care coordination, and reduces healthcare costs. For RHIT exam aspirants, understanding the principles, challenges, and best practices of the continuum of care is critical for supporting healthcare organizations in delivering high-quality, integrated care.